Hello everyone and welcome to my video on what an exercise physiologist is and what our scope of practice entails. So what this video is designed to do is to educate the general public on what our profession is and what we can do for various different conditions, and just having a bit of a roundup of what we're all about. So first of all, we are considered a university qualified allied health practitioner, which means that we have a minimum of 4 years study experience at university. And the reason we need so long to become an exercise physiologist is because there are so many different various conditions that we need to understand. We need to do a lot of research in relation to uh, the different conditions and how to treat these different conditions through exercise, and understanding the pathologies and understanding the parameters and the contraindications to exercise, what we can and can't do with people, and what is safe to do so in relation to different pathologies. So basically what an exercise physiologist does is that we specialize in exercise interventions for various different pathologies. So for example, we work with various different types of cardiopulmonary disease. So that includes cardiac disease, people who are post having a heart attack, people that have asthma, people that have chronic obstructive pulmonary disease, individuals with cystic fibrosis, and anything that comes under the cardiopulmonary umbrella. We also work with people with metabolic diseases, which include and not limited to obesity, dyslipidemia, metabolic diseases such as diabetes type 1 and 2. And we also deal with musculoskeletal conditions, which can be lower back pain, it can be arthritis, it can be osteoporosis, and there's just so many different conditions that we need to know. There's also neurological and neuromuscular, which can be spinal cord injuries, they can be Parkinson's disease, it can be people or individuals with cerebral palsy. And there's also a few other little side umbrellas on the side, such as cancer and mental illness, which we also work with. So a little bit about what to expect when you come and see us. We tend to ask a lot of personal questions, and we tend to try and get a really good idea of you as a person as well as your medical history. So when you first come in, what we might do is do a bit of a screening process, which will include any notes from your doctors or anything like that that might help us get a really good idea of what your history is and what conditions you have. And what this means is that we can then go through our knowledge of various randomized controlled trials and systematic reviews and figure out what will be most suitable for you in relation to exercise prescription. So basically, when you come to see us, what we'll do is we'll design a program for you that is personally catered to you and your chronic conditions, as well as your goals and what you want to achieve, and basically anything to get you up and moving again. We try to make it fun. We try to make it inclusive for your friends and family. But basically, another side of what we do is behavior modification and lifestyle modification, because a lot of different diseases are caused by lifestyle factors. So trying to make you a little bit better and aware of what you're doing in everyday life and how you can make yourself healthier and increase your quality of life. A few things that we don't do in relation to our scope of practice is we don't do any joint manipulations, we don't do massage, we don't diagnose conditions. We might suspect that there might be something else going on and we would refer you back to a doctor, which we are designed to do. That's what we do. We've also been taught how to detect other pathologies that might not have been detected yet. And that's why we have our screening process, because there might be something that you might be unaware of, and we can refer you back to another health professional like a doctor or a GP to really establish what extent that is affecting your life and what exactly might be going on there. We also don't prescribe medication, but we do understand how that can affect you when you exercise and what it can do to you when you're at rest, and when the most appropriate times are for you to exercise safely. And we can also educate you on a little bit about that as well when you come in and see us, that your doctor might not have informed you about that, what you can expect to feel when you're exercising on various medications like beta blockers. Your heart rate won't go above a certain limit because that's what the medication is designed to do, but you might not be completely aware of that. So what I'll try to do now is talk to you about where you might find us. So I'm currently working in a hospital setting, so you would generally find us there in a very clinical post-surgery setting. We also work in private clinics. We also through different health organisations. You might even find us in some sporting settings, as we also design to work with athletes as well as people with chronic diseases. We also specialise in workplace rehabilitation, so designed on getting people back to work if they've had some sort of injury or back problem that's been caused by their workplace and they're trying to get back into work. So that's what we also can help you with. We're in both the public and private sectors, and a lot of health funds do now recognise us in relation to getting your money back on certain services. So when you come and see us, we do deal with a lot of different conditions, and that's what we're designed to do. We are designed to be across the board, so many different chronic conditions, but we do also specialize. So you can look up people that have done courses that specialize in different areas, for example, cardiac. We constantly, every year, we are required to do professional development, so we can choose to specialize in a certain area, even though we might generally know about other areas. We can specialize, so you might find us in those settings. And also in relation to chronic diseases, we're also designed to prevent you from getting other chronic conditions. So you might be seeing us for something else, but we also try to give you a bit of a holistic approach so that we can really make sure that you have the best quality of life you can. Thank you for listening to what an exercise physiologist is. I will try and attach a few links below if you need any more knowledge of what we do, or if you want to try and find us online. I will attach a link in relation to ESSA, our governing body, which can address any concerns you have to do with exercise physiology and our field. Thank you for listening.